Thank you very much for that introduction, and I'd like now to provide my presentation in this ImpediMed series on BIS, bioimpedance spectroscopy, with respect to the assessment of body composition and lymphedema. We're drawing towards the end of this series of webinars, and I hope you've found them all very interesting and informative. So, moving on, I'd like to, first of all, just spend a few moments reiterating something which has been covered a couple of occasions already in this series of webinars, and that is to highlight or answer the question, what does bioimpedance measure? This webinar today is particularly focusing on body composition, but it's important to recognize that BIS and impedance techniques don't actually measure body composition directly. What they measure are electrical properties, impedance, resistance, and reactance of the body and the body's tissues. They do not measure directly a biological attribute, such as total body water. What a bioimpedance spectroscopy technology enables you to do, however, is to transform these raw measured data into very good estimates or predictions of the magnitude of the biological parameter of interest, for example, body composition. And this is an important distinction that one should always bear in mind. And I'll come back to this point in a few moments in a later slide. And that is that bioimpedance doesn't measure directly body composition, but it provides a very good estimate or prediction of body composition. You might ask the question, why are we interested in body composition? And I think that's highlighted quite well by the information presented on this slide. And we're taking as an example metabolic syndrome. This is a syndrome, a set of conditions that affect many hundreds of thousands, if not millions of individuals around the world. And it's characterized by insulin resistance in individuals, leading to type 2 diabetes, coupled with high blood pressure, obesity, etc. And many publications present data as sort of shown in this figure on the left-hand side of the slide. This relates the relative risk or the increase in risk of cardiovascular disease or coronary heart disease mortality, or indeed all-cause mortality, related to a surrogate measurement of body composition, such as waist circumference, waist hip ratio, or the body mass index. And there are many publications showing data similar to this, that there is a significant difference in the relative risk of mortality from these causes in those with metabolic syndrome versus those without metabolic syndrome. Whilst this is very informative from a public health nutrition perspective, it's notable that they're using very simple anthropometric measurements, such as simply waist circumference or your height and weight combined into BMI, as surrogates for body composition parameters. But these very simple measurements can actually be misleading. And that is well exemplified by the pictures shown on this next slide. On the left-hand side, we have a classic picture taken from a well-known article published a couple of decades ago now in The Lancet of two leading nutrition researchers who underwent body composition assessment using DEXA. these two individuals have the same, indeed identical BMI of 22.3 kilograms per meter squared. Yet the DEXA analysis showed that they had very, very different percentage body fat, over a twofold difference in body fat between these two individuals. On the right-hand side, we have the opposite picture. These are two individuals who have identical percentage body fat, but present with two different BMI values, 29.7, 21.6. So two different BMIs do not indicate a difference in body composition in terms of the amount of body fat. So the take-home message is, whilst measurements such as BMI are very simple to obtain, they can mislead you if you try to interpret them in terms of body composition. But bioimpedance spectroscopy can give us very good predictions or estimates of body composition. And just to remind you, because again, this has been covered briefly in previous webinars, of the underlying theory that relates the measurement of electrical impedance and resistance to body composition. In a simple cylinder, there's a simple relationship that relates the volume, the conductive volume of the cylinder, to its length and the opposition to current flow. And that is shown by this formula on the left-hand side at the bottom, that the volume of the conductive cylinder equals a constant known as the resistivity coefficient multiplied by the length squared divided by the measured resistance. If we apply this basic theory to a measurement of impedance in an individual, we consider a person as represented by a series of interconnected cylinders for which this formula applies, which if we measure the electrical resistance and impedance of these cylinders, we can use a measurement of length, a surrogate measurement being the height of the individual. If we have values for the resistivity coefficient, we can determine the volume of the conductive compartment of the body. That is the water volume. Assuming a constant hydration fraction for that water volume in an individual, we can calculate the fat-free mass, and therefore then by difference with body weight, the fat mass of the individual. So an impedance technique allows us to estimate or predict body composition in terms of the fat mass and the fat-free mass. Body composition is considered in terms of models. This slide presents a number of different conceptual models which describe the composition of the body. At the top, we have the simplest concept, which says the body represents a single compartment and body weight is the measure of that compartment. However, if we consider the body in terms of the amount of fat mass and fat-free mass, we have what's known as a two-compartment model. And so on through 3, 4, and higher order models, conceptual models that are used to describe body composition. The model at the bottom of this slide, the 4-compartment model, is generally considered to be the gold standard or reference model for body composition. However, as you can perhaps imagine from looking at the different measurements that are involved in this compartmental model that it's a complex model to determine. Instead, most commonly, we assess body composition using either the 1, 2, or 3 compartment model. And the SOZO, a bioimpedance spectroscopy device, allows us to estimate and predict different elements for these models. The SOZO provides a complete description of the 2 compartment model. It can provide a prediction of the skeletal muscle mass, a subcompartment within the 3 compartment model, and it also provides us information on body water and its 2 subcompartments of extracellular water and intracellular water. So the SOZO is a device which can provide us with body composition information. And it's a technology that compares very favourably with other commonly used methods for the measurement of body composition. These are some data which are comparing the SOZO device, the earlier ImpediMed device, the SFB7, the Leigh type device, both of which are bioimpedance spectroscopy devices, with DEXA for the measurement of body composition. We've adopted the 2 compartment model, so we have data expressed for the fat-free mass, fat mass, and that fat mass as a percentage of body weight, the body fat percent. As you can see, these data are very, very highly correlated with relatively small standard errors of the estimates. So the SOZO and SFB7 devices provide very good ways for predicting and estimating body composition. For those of you who are particularly interested in lymphedema, you may question why there's emphasis on body composition. And this is because body composition is increasingly being recognized as being of importance in lymphedema management. And here are the titles from 2 recently published papers which discuss aspects of the linkage between knowledge of body composition and lymphedema and the management and treatment of lymphedema. It's becoming importantly recognized as something that needs to be considered when treating lymphedema. And I'm indebted to Louise Kohlmeyer for this series of photos as a case example of this linkage between body composition and lymphedema. This series of pictures are of an individual who has lymphedema, leg lymphedema, as clearly illustrated on the left-hand-most photograph. A very high LDEX value, 184, indicative of the presence of lymphedema, here seen as this large difference in leg size for the individual. The individual, the participant, the patient, had treatment for this lymphedema, and 12 months post-surgery, we can see improvement, undoubted improvement in the lymphedema of the leg, but also there's overall improvement of body composition. And that persevered as time went on, with a decrease in the LDEX score from 184 to 36.7, and visually improvement in lymphedema, but also improvement in overall body composition. The outputs that the SOZO provide are illustrated here. This is one of the reports that is obtainable from the SOZO device, the tissue analysis, you will get information in absolute terms, kilograms, for fat-free mass and fat mass. These are those estimates from that two-compartment model. An estimate of the skeletal muscle mass in absolute terms of kilograms, and oops, my apologies. And the data also expressed as a percentage of body weight. In addition, you get information on total body water and estimates of protein and mineral mass and the fat mass repeated from up here. This is the information provided at the time of that measurement, but you can also get history measurement, historical longitudinal information. For example, here we have an individual who's measured on 2 different occasions with a plot of the change in fat-free mass and fat mass. As you can see, as time has gone on, fat mass has increased, fat-free mass has decreased. On the basis that increasing body adiposity is not a healthy strategy, the impedance device and these measurements provide a very important motivational tool to an individual to alter their lifestyle to ameliorate these changes in body composition. So to summarize then, the SOZO device is a bioimpedance spectroscopy device, which is a convenient device for the measurement or assessment of body composition. It can measure all body segments, arms, legs, trunk, and the whole body. At present, the information for body composition is provided for whole body only, but it also provides information on body water volumes. And as we all know, this is critical for assessment of fluid accumulation in lymphedema. So I hope this has helped set the background for the case studies to be presented shortly by our other speakers. And thank you again for your attendance at this webinar. And I'd now like to hand you back to Adam for the next presentation in this webinar.